Well, I think part of the answer is people just follow the data. And while I think everybody would agree, and we've talked about this before, that there's not enough testing that goes on generally, nationally, for a whole bunch of reasons that we've also talked about before. If you're one of the states that tests the most, you're likely to be one of the states that finds the most positive cases. And if you test in places where you're looking to provide strategic advice and guidance to particular communities or particular organizations or particular healthcare providers, you're going to find positive cases too. And I think some of it has to do with the nature of the way we've gone about testing, but I also think part of it has to do with some of the issues that have been raised previously by others who've covered this issue. One is that if you look at most of the states that have the highest number of positive cases or the highest number of hospitalizations, they tend to be states that are dense, relatively speaking, compared to others, or they have particular areas of density. Louisiana, for example, had an enormous outbreak in New Orleans, but most people think that was related specifically to Mardi Gras. If you get outside of New Orleans, the rest of Louisiana is relatively spread out. In Washington State, the big outbreak was in Seattle, which is obviously a city, but the rest of Washington State is also relatively spread out. I think the other big issue is your access to and your connection to the global economy. And if you think about most of the places that have had the most significant outbreaks, they're places that have tons of back and forth, used to have tons of back and forth travel and economic activity between here and many other places around the globe. I think at the end of the day, there will be tons of research that will be done, not just on coronavirus and not just on state responses, but how people ought to think about dealing with a pandemic of this kind going forward. But in the meantime, what we all need to do is what many other states and many other countries have been doing, which is create the separation and the distancing that's required to stop the spread of the virus, create enough healthcare capacity to be sure that you can solve for those individuals who are dealing with COVID-19 and continue to provide the other kinds of services that healthcare systems like ours are so well known for. And then start to think, once you get to the point where you start to see some data that trends in a positive direction, how you actually might safely or more safely choose to reopen some of the things that we've all given up to fight the virus.
Governor